This video will help you learn how to use and care for your feeding tube. You will learn about types of feeding tubes and different feeding methods. You will also learn how to care for your feeding equipment, solve problems on your own, and how to obtain supplies. In this section, we will review types of feeding tubes. This slide shows nasogastric, nasoduodenal, and nasojejunal tubes. These tubes are inserted into the nose and end in the stomach or small intestine. Your type of tube is based on several factors. These include the reason for the feeding tube, the length of time that tube feeding is needed, your medical history, and how your digestive tract functions. For example, a nasogastric tube is usually used short-term, in most cases less than 4 to 6 weeks. Other types of tubes are needed for feedings longer than 4 to 6 weeks. These tubes are placed while you are under sedation. These include a percutaneous endoscopic gastrostomy tube, called a PEG, a percutaneous fluoroscopic gastrostomy tube, called a PFG, or a jejunostomy tube, called a J-tube. PEG and PFG tubes are placed to allow for feedings through the stomach. J-tubes are placed to allow for feedings through the jejunum in the small intestine. Your care team will talk with you in detail about your tube and how it will be placed. In this section, you will learn about one type of feeding called gravity drip feedings. Gravity drip feedings are administered through a tube that feeds into your stomach. Begin by cleaning the surface that will hold your supplies. This may be an area such as your kitchen counter. Next, wash your hands thoroughly with soap and water. Gather your supplies. These include your formula, the bag and tubing set, a 60 milliliter syringe, and regular water. The formula should be at room temperature. If you have a partial can or carton remaining from a previous feeding that is refrigerated, take it out of the refrigerator for about 15 minutes before pouring it into the bag. Do not microwave the formula. This is a gravity tube feeding bag. This picture shows the parts of the bag that you will use during feeding. You will pour the formula into the top of the bag. Fill the syringe with at least 30 milliliters of water. Unplug the end of the tube and connect the syringe to your feeding tube. Unclamp the tube and flush or push water into your stomach. Clamp the tube and remove the syringe. Shake the carton or cartons of formula well. Pour the formula into the feeding bag. Squeeze the drip chamber until it is half full. Open the roller clamp to allow the formula to flow to the end of the tubing. Clamp the tubing when formula comes to the end. It is okay if a few drops come out. This is called priming the tube to remove air. Open the end of your feeding tube. Connect the feeding bag to your feeding tube. Unclamp your tube and adjust the roller clamp to allow the formula to start flowing. Make sure the drip chamber is above your head so it will flow properly. The drip rate should be about 1 drip per second. The feeding should take about 30 minutes per can. When there is very little formula left in the bag, add the prescribed amount of water to the bag. Allow it to flow through the tubing and into your tube. You can also use the syringe to do this flush. When the feeding and flushing are complete, clamp your tube. Disconnect the gravity bag from your tube and close the plug on your tube. Place any unused formula in the refrigerator and use within 24 hours. Sit upright during tube feeding. If you must remain in bed, place 2 pillows behind your back. Do not lie down for at least 30 minutes after a feeding. Each bag and tubing should not hang for longer than 12 hours before it is cleaned. After feeding with gravity bags for a few weeks, you may want to transition to syringe feedings. Sometimes bags and tubing are not covered by insurance. Syringe feedings are more cost-effective if you must pay out of pocket. These are the steps in syringe feedings. Flush the tube with 30 milliliters of water using a syringe with a plunger. Clamp the tube and remove the syringe. pull the plunger out of another syringe, and connect the syringe to the feeding tube or extension set. Unclamp the tube and pour 60 milliliters of formula into the syringe. Hold the syringe up and let the formula flow into the stomach using gravity. The higher you hold the syringe, the faster the formula will flow. Repeat this until you have completed the recommended amount of formula. Once the feeding is complete, clamp the tube and remove the syringe. Flush the tube with at least 30 to 60 milliliters of water using the syringe with the plunger. It can be convenient to feed this way for travel or coming to appointments. Between each gravity feeding, rinse the bag and tubing with warm tap water. Drain as much water as possible out of the bag and tubing. Place this in a sealed plastic bag and store in the refrigerator until the next feeding. If you receive one bag per day, skip the washing step and throw away the bag after your last feeding of the day. If you use the bag for several days, wash the bag and tubing with liquid dish soap and hot water. Make sure to run the soapy water through the tubing. Rinse thoroughly and drain. This bag and tubing can be used for 5 days. If your tube feeds into the small intestine, you will need to use a pump. In this type of feeding, formula is placed in a feeding bag and is pumped through the tubing into the patient. Your nutrition needs will determine the type and amount of formula provided. Your dietitian will determine if you will infuse the formula over 24 hours or over shorter time periods. Your dietitian will also determine the best type of pump for you based on your feeding schedule. A hospital nurse will teach you how to use your pump before you leave the hospital. Your durable medical equipment, or DME company, will also teach you how to use your pump. Your dietitian will teach you about your home tube feeding regimen before you leave the hospital. Medicines can be administered through your feeding tube if you are unable to take them by mouth. Liquid medicines can be mixed with water and pushed into the tube with a syringe. Talk with a pharmacist before you crush pills to put through the tube. You must crush pills and then mix them with water before pushing them through your tube. Do not mix medicines with formula in the feeding bag. Flush your tube with 30 to 60 milliliters of water before and after you put medicine through your tube. It is best to put one medicine at a time through the tube. Mixing medicines may clog your feeding tube. This section will address problems you may have and how to solve them on your own. If you have nausea or vomiting during your feedings, slow down the rate of your feedings. If this does not help, talk with your dietitian if you still have problems. If needed, your doctor can prescribe medicine to help with nausea. You can lose too much fluids with diarrhea. Be sure to increase your intake of water through your tube. Contact your doctor if diarrhea lasts more than 24 hours. If you have constipation, be sure to meet your fluid goal as recommended by your dietitian. Increase your fluid intake as needed between feedings. Water is best. Increase your activity level as recommended by your care team. Talk with your doctor about taking a stool softener and/or laxative, especially if you take pain medicine. Contact your nurse or dietitian if you think you may be constipated. Follow their directions on how to give this medicine through your feeding tube. Cramping may be due to formula that is too cool. Make sure the formula and water flushes are room temperature. Slow the formula drip rate and slow the rate when giving medicines and water flushes. To help decrease gas, clamp or plug the tube immediately after feeding to avoid extra air in the tube. Ask your doctor about medicine to help with gas. Increase your fluid intake by using water flushes through your tube. You may be constipated. Follow the previous tips for constipation. If you are allowed to take fluids by mouth, take more water between feedings. Increase your fluid intake by using water flushes through your tube. You may need more fluids if you have a fever, diarrhea, or constipation. If you need help with tube feeding, contact your nurse in your home clinic, your dietitian through MyChart, or call the Clinical Nutrition Triage line at 713-563-5167. For pump or supply problems, contact your DME company. A dietitian will help you choose a DME company based on your insurance coverage and delivery location. The DME company will review with you what supplies are covered by your insurance company. It is a good idea to contact your insurance company to discuss your tube feeding formula and supply coverage. Once you agree to receive supplies, the DME company can provide all of the supplies and arrange to have them delivered to you. It is a good idea to clarify with the DME company if they will automatically send supplies monthly or if you need to call them each month. Ask for contact information in case you have questions or concerns. Dietitians, do not contact insurance or DME companies. In summary, your care team will work with you to determine what type of tube and feeding method is best for you. If you need more help after trying the problem-solving tips in this video, contact your MD Anderson Home Clinic, your dietitian through MyChart, or call the Clinical Nutrition Triage line.